Good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRNAM for Wednesday, October 25th, 2023. And our top story today, Americans may forego dental treatment due to cost. And joining me now to discuss this and a lot more, Matthew Muscolo is with Care Credit. Matt, it's great to see you. Thanks so much for joining us on the program this morning.
Yeah, thanks for having me, Jeff. Pleasure to be here with you and your audience.
Yeah, and I should say this is perfect timing because yesterday I actually went to the dentist to get my teeth checked, and I do have insurance. But what I found really interesting about this study, the Synchrony study about dental treatments and dental care, a lot of Americans are foregoing dental treatments, and that has me real worried.
Yeah, that's right. You mentioned something from the study that we found was that 9 out of 10, or more than 90% of people, have or will delay necessary dental care because of cost. It's definitely something that's impacting consumers and something that needs to be addressed through affordable options like insurance, like FSA and HSA plans. As well as health and wellness credit cards like Care Credit.
Yeah, and one thing I picked up from the study, I had no idea about this, and I know as you get older, healthcare costs go up, and we've seen studies in the retirement industry about the costs in retirement. But dental care can cost from $55,000 for a single adult all the way up to $95,000 for a family across a lifetime. And that, I think about the teeth. You only get one set of adult teeth. That's a lot of money, and a lot of money that could be offset by what you described, insurance, FSAs, HSAs, et cetera.
Yeah, that's absolutely right. I think the study provided a lot of insights into the financial, emotional, and psychological factors impacting the cost of dental care, and frankly, how those factors affect Americans' dental care decisions. You mentioned the cost. I think those numbers are actually just the foundation for general care. Certainly, a lot of Americans will incur additional costs with orthodontics, implants, or more complex care that can add tens of thousands of dollars to the numbers you mentioned. And frankly, the attitude towards the affordability of dental care is surprising. Again, the survey found that more than half of the respondents felt that dental care was not affordable. And for those without dental insurance like yourself, that number rose to 75%. And that's really not a static number. You mentioned kind of the span of folks. For younger generations like the millennial and Gen Zs, that number is more than 50%. But that number goes up to 67% or more for elderly patients. It really is a significant barrier to care. We mentioned the 90% of people that put off care. That's general care. Frankly, what may be even more frightening is that 80% of people put off emergency dental care. And usually people that are in need of emergency dental care are in pain, or frankly having trouble chewing or eating, and having quality access to daily quality of life. So it's definitely something that shouldn't be ignored.
And it shouldn't be ignored because that we've learned a lot in science and medicine. If you have things like inflammation of the gums, it is really the entry, I guess, into the body. It's where you digest all your food, you salivate, you do all the things, you taste. But if you don't take care of the dental, you don't take good dental care, you really can have onset of things like cancer and other really significant ailments.
Yeah, that's right. I think Americans' awareness of the importance of dental care has never been greater. You mentioned, inflammation that starts in the mouth will go to the whole body, and chronic inflammation is something, right, that we're finding out more and more is the underlying cause of a number of conditions and afflictions. So it really kind of starts with the mouth and goes to the whole body. And again, just peace of mind, right? Making sure that you are not in pain, that you can be confident in your smile, that you have peace of mind when you're having interactions, with people, to ensure that kind of quality of life. It definitely cannot be understated how important it is.
Yeah, and my understanding is during the pandemic, maybe some of the hygiene skills for many maybe slipped a little bit.
Yeah, That's right. You can count me guilty as that as well. My regular dental routine included getting up in the morning and getting ready to go to work and go in the office. And as people lost that routine, one of the things that fell to the wayside was that kind of routine or proper dental care, dental maintenance, brushing, flossing, things like that. So I think it's important for people to find a way to make sure they're doing that routine care, both at home every day, as well as seeing the dentist, twice a year, once every 6 months. Happy to hear that you did so the other day. But yeah, I think it's critical for a number of reasons. We talked about people delaying care. Delaying care is only gonna kick the can down the road, right? It's not gonna go away. So what people are finding is that delayed care is causing increased care and increased costs down the road. So important to make sure that we're addressing that every day, and seeing the dentist regularly for sure.
Well, Matt, I need to take a very quick break. When we come back, we're going to talk about how do you go about paying for dental care, because you don't want to miss doing it. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network. Welcome back. We're joined this morning by Matthew Muscolo of Care Credit. Matt, thanks so much for sticking with us. Really appreciate you hanging around for segment number 2 this morning.
Yeah, absolutely. Happy to stay with you in the audience.
And I should add, we brushed in between segments during the commercial break. Can you see this? The ding. All right, Matt. It's in all seriousness. The cost of dental care to get a cavity, a root canal, some kind of procedure. Sure, it can be expensive, but the tools that you can use either through your employer or individually to offset those costs, people can access dental insurance. It's very affordable.
Yeah, look, first and foremost, I sympathize with what a struggle it can be to pay for the care that people want and need. It's very intuitive for us to save for things like a mortgage or retirement or vacation, things like that. But as the survey pointed out, only 26% of people save for dental expenses. And frankly, they're not saving enough. So what that creates is gaps. And I think what you're getting at is what are some of the ways that we can then address some of those gaps? You mentioned dental insurance. It's widely available through a number of carriers. at a relatively, meager cost, as well as you should inquire with your dentist. A lot of dentists themselves will offer kind of regular care packages that'll cover things like, well visits and minor, dental needs. I think beyond that, it's important for people to be aware of what their options are. And I think planning is key. Make sure you're taking advantage of the benefits that are offered by your employer for those that are employed, or that people have retirement, benefits from those employers as well. So, and then beyond that, I think again saving. I joke. My mom always told me to make myself a bill. If you don't prioritize saving, for yourself along with your obligations, it's far too easy to miss it. So I would encourage people to find like a high yield savings bank. Synchrony offers a great high yield savings options, and park those funds somewhere where they can help you earn money, so you have even more when the time comes. And I was heavy remiss if I didn't mention Care Credit and some of the flexible financial plans that we have as well.
Yeah, and let's talk about flexible spending accounts, because I think that's something that oftentimes it's offered through an employer. Maybe people, they get it if they've used it before, but sometimes it takes a little bit of time to get used to it. That is a great source to offset. Like you park money away during the calendar year, during the plan year, and you can use that to offset medical expenses, like maybe there's Invisaligns or some other enhancement to your teeth.
Yeah, again, I would encourage people to explore, multiple healthcare, financing options. A lot of those plans are tax-free savings as well, so take advantage of those for any, qualified dental expenses. And again, just make sure you educate yourself. I would encourage all your viewers to visit carecredit.com to learn more about our plans and how we offer flexible spending. And again, this whole thing is about the lifetime of care. So one of the great things about Care Credit is that it's a revolving line of credit. It's not a one and done. It's there to continue to provide financial flexibility for yourself, for your family, as those dental needs continue to arise. So again, I think education and awareness are critical. Understanding what your options are, and how you can best utilize those options, and what options are best for you and your family.
Yeah, and when you mention education, Matt, I'm also thinking about if you got kids, or you have nieces, nephews, or cousins, whatever, making sure that they have the right dental hygiene is important, because a lot of times you learn that from your parents, and going to the dentist every 6 months, getting those x-rays, making sure you're flossing when you can. Those are important things that even the youngest of our generations need to be educated about.
Yeah, that's right. Don't be afraid to be an advocate for yourself as well as your loved ones. Invest in yourself and your smile. You already touched on how important that is to your overall health. So definitely critical to make sure we're starting young and continuing those good habits through adulthood and to our senior years. So again, those costs only expand if we delay some of that care. Yeah, but you mentioned education awareness. I'm a big advocate of that. But also encourage your audience to go to dentallifetimeofcare.com, where they can get access to the full study, and again, better educate themselves on what options are out there, and make sure that they're in a good place to cover the costs that are coming, both expected and unexpected.
Yeah. Well, Matt, it's great information, really important. Great to see you. Thanks so much for joining us, and we look forward to having you back on the program again very soon.
Thanks again, Jeff. I really appreciated our time today. Thank you.
And that wraps up this episode of BRNAM. Have a topic of interest, someone you think we should talk to? Drop us a line, and don't forget, for all the latest curated news and lifestyle, wellness, finance, tech, so much more, and all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content? Well, then visit our website. We're back again tomorrow with another great edition of BRNAM. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes. Now is your opportunity to co-create content around any topic on the first lifestyle and wellness network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.